don't forget to subscribe and like this video. And the most important thing, I will be waiting for your comments, especially for this video. Thank you for now. Hello everyone and welcome again to my show.
Stage 4 is here, our COVID hell far from over. Victoria is this very minute entering a state of disaster, and all of Melbourne will be under a strict curfew from 8 o'clock tonight as the way we shop and exercise is limited even further.
Today I'm going to talk about stage 3 restrictions and stage 4 restrictions.
From 6 p.m. tonight, I am declaring a state of disaster. From 8 p.m. tonight, a curfew will be implemented. So there will be a curfew across metropolitan Melbourne from 8 p.m. this evening.
And guess what? I have really good news for you. And I would like you to watch the whole video. We found vaccines, more than 80 vaccines being found. We'll talk about this later. If you living in Victoria, I'm really sure you know that what we are going through right now, it's getting better in some ways. Might be stage 4 start working now. In Victoria, exercise, going to gym, doing any activities that we can't do anymore. So it's getting really hard, but the good thing here, looks like stage 4, it's working now, which is good. As we know, almost 1 million Australian lost their job. So almost 1 million Australian lost their jobs since social distancing measures to limit the spread of COVID-19. It's hard, but we are getting there. We are getting somewhere. As what we always hear on the news, scientists, they actually found vaccine. Well, we'll talk about it later. It's so good, it's really good news, but we'll talk about it later. We'll leave it later. Okay, as we all know, the first wave of coronavirus in Australia, Australian borders being closed to all non-residents. That was on the 20th of March. And social distancing rules were imposed on 21st of March. And state governments started to close non-essential businesses or services. And 2nd of April, anyone must not leave their principal place of residence except for essential needs, including work, food, medical, and exercise. 4 reasons only allows you to leave, and outdoor gathering only up to 2 persons or with members of households. You can have only 2 visitors at your house. 2 visitors only. That was back then, the first wave of COVID-19, and no gathering in public. No gathering in public. But guess what? In Australia, we really have really good government.
Government policy will surely be the most disastrous economic and social catastrophe in Victorian history. Premier, how will you take personal responsibility for this? You've told us on numerous occasions you will be personally responsible. What does personal responsibility mean?
Well, in the first instance, Mr. Reardon, it's not playing political games. I have not only accepted ultimate responsibility and accountability for any issues in that part of our pandemic response and all issues in our pandemic response, but I've established an appropriate arm's length process chaired by a former judge, not for the avoidance of scrutiny, not for the avoidance of answers, but to deliver that scrutiny and to provide the answers that all of us are fundamentally entitled to.
We are really blessed to have them with restrictions. They're really down to earth. Our government really down to earth. They're actually allowing us to do whatever we want to do, and we actually can exercise. We can catch up on the streets. We do whatever we want to. And we did. Back then, we did whatever we wanted to do. Catching up with friends, more than 2 persons, exercise, and even with the restaurants. I've seen people like they've been eating inside a restaurant in western suburb of Melbourne. These are restaurants, there's no need to mention some names. I've seen actually people a couple of times dine in. That was back then. Well, that's why I said we are blessed to have our government. They are too lenient. Well, with restrictions, no one cares. Believe it, people are doing what they meant to do. What we do, it's actually with restrictions, stage 3 restrictions, we've been living our normal life. People having visitors, people had parties at their homes. If they are too loud, of course, someone will call 000. Second wave of coronavirus started not long ago. Now it's almost 2 months. Well, here we go again. The restrictions that we have right now actually quite similar to the stage 3 restrictions. Here we go again. When I go outside, when I drive around on the freeway, shopping centers, wherever I go, I see the same amount of people. So no difference happening. Well, the only thing that we can notice, people wearing masks. Yes, so which is good in some ways. Still there's some people, they're still resisting, they still don't like the ideas wearing face mask. Yeah, well, but still our government really too lenient. I'm not sure if it's good or not, but what I think, it's really bad. Because in Victoria, it's our third lockdown. Victoria been locked down 3 times. Okay, every time, each time 6 weeks. And almost 1 million Australians lost their jobs. It's sad to hear. And it's sad to hear the amount of people lost their life. Right now, stage 4 restrictions, curfew from 8 p.m. to 5 a.m. curfew. So we are already sleeping. Even 8 p.m. no shops open, so nowhere to go. What's the point to have curfew at night time? The best thing to do, just have us for once. You don't have to repeat it every time. Full lockdown. Yes, you can allow a couple of shops to be open, necessary only. Okay, when you allowing people to go for walk, exercise, so you are still allowing people to catch up, to meet, gathering. It's not good. So you have to change the way you are dealing with coronavirus. Okay, let's talk about the vaccine.
And we had 2 objectives. One, to speed up development of a vaccine. Second, to ensure fair distribution so that people who may not have access can have access. Because of financial problems, they may not have access. These 2 objectives are very, very important. But to make it happen, especially the fair distribution, there should be a global consensus to make a vaccine, any product, a global public product. And this is a political choice, a political commitment.
The good news here, they found vaccine. Wow, it's amazing. I'm really amazed that we found vaccine. So 4 months ago, the University of Queensland found COVID-19 vaccine.
Australia kicked off the first human trials of a potential COVID-19 vaccine on Monday, developed by scientists at the University of Queensland. The trials began in the morning with a group of volunteers, and the preliminary results of the trial are expected to be released by the end of September. Paul Young is the co-leader of the trial.
Like every vaccine trial, this may or may not succeed. It's not a guarantee, but we're confident that we'll get through there to a positive outcome in the end.
Yes, look at it. They did find vaccine for coronavirus in Australia here and being tested on human. That vaccine being tested on animals and human, and it's working. And they are really confident about it. It's working. That was 4 months ago. They've already found the vaccine. They've been showing it everywhere. It's really good news, isn't it? Okay, it's not just them. It's not just in Australia. Many countries around the world, they found the vaccine. Australia found the vaccine more than 4 times since the coronavirus began in Australia. 3 months ago, the same university, the same uni in Queensland.
Queensland have put Australia at the forefront of the race to find a coronavirus vaccine, with early testing delivering outstanding results. For more, Jessica Millward is in Brisbane. And good morning, Jess. Is the vaccine working?
Well, it is, Alex, and researchers in the Netherlands have said that we are now at the forefront of global coronavirus vaccine science. They are working in a lab in the Netherlands testing the UQ drug, and we should expect those results in a couple of weeks. But we already know from the UQ researchers that they've had very positive results trying to produce this vaccine. Early clinical trials have gone well, testing on animals have gone well, and all going well moving forward. We could see a vaccine being produced by the end of the year. Of course, we'd have to jump through a lot of hoops before that could happen and before it could be administered on humans. The World Health Organization estimates that around 80 vaccines for the coronavirus are currently in the works, so we could end up globally with more than one.
COVID-19 vaccine being found, and more than 80 vaccines being tested on animals and human, and most of these vaccines being working. See, most of the 80 or more than 80 vaccines being found around the world. Many countries found the vaccines. We can see here, it's really great news and good news. 3 months ago, Italy claims first COVID-19 vaccines.
Italy has claimed that the vaccine works on humans. Now, according to reports, Takis, which is the Italian biotechnology firm developing the medication, has claimed that this is the first time since the race for a COVID-19 vaccine began in the world. As per the test carried out in Rome's infectious disease hospital, the coronavirus vaccine has antibodies generated in mice that work on human cells.
Works on human. A couple of them been found 3 months ago. 4 weeks ago, Australian starts trials for COVID-19 vaccines, and it works. Here we go again. They are all working. More than 80 vaccines, most of them are working. Wow.
Everyone agrees that the only way life will get back to normal is when there is a vaccine for COVID-19. And some good news on that front today. Human clinical trials for a potential vaccine are underway in Australia. We're joined by the principal investigator, Dr. Paul Griffin. He's in Brisbane. Thanks for your time tonight.
Pleasure.
So, Dr. Griffin, you're going to use healthy adults for this trial. What are you watching for?
So the main thing we look for in a phase 1 trial is to prove the safety we strongly expect from the data we've generated already to this point. And we also look to see if it's working by collecting some blood tests and doing some tests in the lab to see that these people have generated a good response to the vaccine, and look at all their immune cells to see that they're also primed against the vaccine as well. So 120 volunteers will participate in this study. So the preclinical data, the data in the laboratory and in animals was very positive. It looks very safe and generated a really good neutralising antibody response. So we're very optimistic that this will translate into seeing a good effect in the human trials. Yeah, look, it's been challenging. We've never progressed vaccine development as fast as this, and we've never worked under so much pressure. But obviously we know how important a vaccine for COVID-19 will be. So we've certainly been really motivated to keep working that hard. And it's really good to see that reward for effort now that the vaccine's made it into people in the clinic. And so we're really looking forward to seeing the results from the human trials. There's been many. I think developing a vaccine as quickly as this, and then I think trying to move as quickly through all the usual steps. It usually takes 7 to 10 years to develop a vaccine, and we've had to do that in many months while not skipping any steps, obviously, to make sure we're as certain as ever about the safety and efficacy of this vaccine. So we've progressed really quickly, and now the human trials will also progress quickly, but as I say, without skipping any of the necessary steps to make sure it's safe and effective.
Wow, really good news. I'm happy. Even you, I'm really happy to hear it. And we all are happy to hear it. Finally, we are going back to our normal life again. We are getting our normal life style back again. Wow, we should celebrate. We should take our mask off. So who cares anymore? All this good news about vaccines being found making me really happy. I'm not going to wear mask anymore. I will be walking down the streets, going to the shop without face mask. So they already found the vaccines. Queensland University, more than 3 times, they found the vaccine. And in Adelaide and in Melbourne. But I have a question. Why don't they supply it to us yet? And why don't they use it? We have people in intensive care. They should use it on them. They said most of them being tested and they are working. They should use it. Why they don't use it yet? They should save some lives. Okay, we have coronavirus cases in intensive care. Don't you think it's funny? All this, more than 80 vaccine being found. Most of them tested and they are working. Why they don't use them to help everyone in intensive care? Wow. Look, I'll tell you something. What we've just seen, it's big lie. There are no vaccines. There is no vaccine being found. No way. Don't you believe me? Don't ever take your mask off. And I want to. Don't ever take your mask off. By what they're saying, thousands of us will rely on what I just heard on TV. Basically, they are making it worse. There is no vaccine being found. Many of us being disappointed. Don't you believe me? Just watch this video.
Now there's one thing all 8 billion of us on Earth wish for: a vaccine for COVID-19. Around the world, political leaders, sweating on getting us to the other side of the pandemic, promise it'll happen within 12 to 18 months. But hang on a minute, vaccines normally take decades to formulate, and quite often success never comes. So why should we be so optimistic now? As Liam Bartlett finds out, some scientists say talk of a coronavirus vaccine is not only raising false hope, it's fake news.
A safe vaccine, available to all, affordable to all.
It's the great hope galvanising the world. A vaccine for COVID-19.
It's humanity against
the virus.
We can't get back to full normal until we develop vaccines.
For a planet and its population in lockdown, it's our one sure way back to normal.
Our best and brightest medical minds and researchers are working tirelessly.
But are we being sold a lie? After all, COVID-19 is the 7th coronavirus to strike mankind, and we've never found a vaccine for any of them.
We are very confident that we're going to have a vaccine at the end of the year.
To quote a famous president, it's fake news. The shortest time anybody's ever found a vaccine against any disease that I'm familiar with is about 7 years. The average time is 20. To be talking about a magic bullet coming in months it borders on the absurd. I'm not saying don't spend the money. I'm not saying don't do the research. But we can't plan public policy on a miracle. Look, viruses are very clever. We have no AIDS vaccine right now. We've been looking for that for more than 25 years. There's no vaccine for hepatitis C. Even the flu vaccine we've got, which we've been working on for decades, is about 40% effective in a good year. There's no guarantee we will find something to beat this virus. But the idea that just because a lot of teams work on this, it's going to give somebody the breakthrough, that doesn't follow.
The University of Alabama is one of the front runners in the race for a vaccine. Professor Fran Lund, working with the US pharmaceutical company Altimmune, is taking an influenza vaccine that's already highly developed and modifying it to fight the coronavirus. But even more impressive, this vaccine will be administered as a nasal spray, putting it right where the coronavirus first infects its victims.
I think now we know the truth. Don't believe what they say. And stay home and always wear face mask and gloves or use hand sanitizer. You have to protect yourself. No one else will protect you. Thank you for watching and I will see you in my next show. Goodbye for now.